Hi, Dr. Sanjana with Castle Hills Family Practice. Today we are at the conclusion of our joint pain series, and the last pain we are going to talk about is a commonly occurring pain which in layman's term we call it the heel spur, or in medical language we call it plantar fasciitis. This condition happens due to inflammation at the ball of our heel where there is the origin of the plantar fascia. So our foot has an arch, and the arch has to be maintained by a rope-like ligament called the plantar fascia, which extends from the ball of the toe to the heel, and it keeps the arch nice and taut. But when our body weight increases, then there is a constant pressure to try and flatten the arch, which cannot happen because this ligament is not elastic. So if you try and flatten this arch by weight gain and not wearing proper supportive shoes, the arch will not necessarily flatten, but it will start causing a tear of the ligament or the plantar fascia, which causes inflammation in the ball of the heel. And that pain is a very severe pain. Typically, patients tell me that they wake up in the morning and as soon as they put their foot down, there is excruciating pain. They can't walk on it, they try walking on tippy toes, which makes it worse, and resting it, icing it helps, but not much. My suggestion to them usually is to try and wear proper arch support shoes. The big culprit is the flat shoes that we wear in summer, which doesn't have good support, or the fancy shoes that nowadays everybody likes to wear, which are not well made and don't have an arch support. So when you wear proper arch support shoe, that prevents your heel from getting the damage, that prevents your plantar fascia from tearing or causing inflammation. If you don't prevent this from happening, slowly the plantar fascia pulls the bone from the heel, and therefore the formation of the heel spur, which is seen on x-rays. The treatment for this condition: anti-inflammatory, resting it, icing it. The number one thing I tell them, buy some good tennis shoes or athletic shoes which have arch support. Makers like Nike and Adidas and New Balance, they have good arch support shoes for cross training. I tell them to go buy that. There are more expensive arch support shoes available, and custom orthotics can be made by podiatrists. But typically the arch support tennis shoes help, anti-inflammatory medications help, stretching the foot before you get down from the bed helps, resting it, icing it, it's a matter of time. Sometimes injections are given in that area to decrease the pain, like a steroid injection, and there is a strong role for physical therapy in that too. But this conservative treatment helps 80 to 90% of the time. So if you're having heel pain or plantar fasciitis pain or heel spur, come see us, we can help.